And we are back. While nearly 7 million adults in the U.S. live with plaque psoriasis, much information still exists about the disease. Now, plaque psoriasis is more than just a skin condition. It's a chronic autoimmune disease that starts within your body. And join me now sharing more is dermatologist Dr. James Song and plaque psoriasis patient Marjorie. And we thank you both for being with us. And Dr. Song, as we talked about, this is prevalent in the lives of more and more people. For those who may not be so familiar, talk about how the onset begins.
Yeah, so psoriasis is what we consider an autoimmune condition. So it leads to chronic inflammation that affects the skin. And common areas that are affected are like the scalp, the elbows, the knees, but even the skin folds and the nails can also be afflicted as well. And as far as symptoms, it ranges from itching to burning, as well as just soreness, especially when the skin starts to crack and bleed, especially on the hands and feet. And psoriasis can really affect any age group as well as any skin color. And so if you're more kind of fairly complected, psoriasis can look more kind of light pink to scaly, whereas if you have more color in your skin, it oftentimes looks more purplish gray or even kind of brown. And in the wintertime, a lot of our psoriasis patients can flare because of the colder, drier temperatures, as well as the lack of light, or sunlight, I should say, that can actually be beneficial for some patients.
Yeah. And so I have Marjorie with us as well. And Marjorie, thank you so much for being with us and sharing a little bit about your story. When we talk about dealing with plaque psoriasis, obviously for yourself, you're overcoming, but how is this really impacting you?
Well, because my plaque psoriasis is primarily on my hands, on the palms of my hands, and then on the tops, it affects everything that I do in my daily living. I love to cook and I love to bake. So I have found that I have to wear an exam glove or exam gloves while doing those activities. And then once it hits springtime, I'm out in the garden, and gardening gloves are going to be a must for me at all times, no matter how big or small the job is. But I think the worst part about having the plaque psoriasis on my hands is that I meet and greet new people, and we normally do that with a handshake, and I'm hesitant because I know how dry my skin is, and if they can feel the dryness and the plaques on my skin, it's embarrassing.
Yeah. And Dr. Song, when you have a case like Marjorie's that she talks about, really the psychological, that's a lot to contend with. What advice are you giving people to kind of like deal with that? Because that's also, you got to deal with the psoriasis itself, but then you also have to deal with the emotional and the psychological.
Yeah, so absolutely. We know that psoriasis could affect your quality of life in many ways, not just physically. So I think first and foremost, you want to see a board-certified dermatologist that could treat you holistically, not just from the skin, but some of these other aspects that Marjorie was just talking about as well. And for a lot of our patients, we recommend starting with topicals, whether that's a cream or an ointment to kind of relieve some of the symptoms. But for many patients, that's not enough because, one, it doesn't treat an underlying cause of that inflammation, but it can also be pretty tough to be using on a regular basis. And so if you have psoriasis and you're struggling with your symptoms and topicals are not enough to control it, and we really do recommend talking with your dermatologist and maybe see if an oral option is ready for them.
Margie, for yourself, obviously dealing with this has been somewhat of a challenge. You're talking about the gloves, you're talking about the other different adaptations that you've had to make in life. What's it been like for you, given the fact that you know that you've got to deal with psoriasis, but yet and still there's so much more of life that you're enjoying and there's so much more of life that you're embracing. Talk to somebody else who may be really dealing, but needs your perspective and understanding that, you know, this isn't the end. There's just some adjustments that need to be made.
Yes. The first thing is to get a proper diagnosis of this. And I do encourage people to go see their dermatologist and get that proper diagnosis and then work with your dermatologist to find what works for you.
And Dr. Song, when we talk about that dermatologist and talking about getting that right person, you know, part of that right person is getting the information from your doctor. And getting that information is going to be right and relevant. So many times there are misconceptions, stereotypes, and we do a good job on this show of trying to debunk some of the myths and the stereotypes that may be associated with plaque psoriasis. And so can you unpack a few for us about maybe what are some of the more common misconceptions?
Yeah, probably the most common misconception is that this is infectious, that this is something that you could pass on to somebody else. I've had patients say that they can't go to the same gym or swim in the same pool as others because they were worried they were going to catch it. So there's a lot of misconceptions going on, and that's why Margie and I are really here on behalf of Amgen. We want to raise awareness about this misunderstood condition. But as I was mentioning before, this is due to an overactive immune system. You got the genetics for it. Something in the environment turns those genes on, and you get this ongoing inflammation that makes your skin grow much more rapidly than it should.
Yeah. And so, Margie, for yourself, talk to me about winter. What's it like during the wintertime?
Winter can be more challenging because it's drier, and the dry skin comes from the dry air, so you have to be more aware of moisturizers and what is best to use on your hands.
Yeah. And so,
For
Doctor,
you, not
right.
it's not for everyone.
Right. So what you use may not be the same thing as what everyone else uses, and that's understandable given the case scenario. Dr. Song, when we talk about patients coming forward, having that conversation, it's a lot easy as well. It's pretty easy for people to, misdiagnose and self-diagnose. When is the time that people really know maybe I should see a doctor?
Yeah, so psoriasis can sometimes just look like dry skin, or it could look like other dermatologic conditions as well. So if it's not getting better and you feel like you're seeing your primary care doctor and whatever they're using is not improving your symptoms, I would recommend you see a board-certified dermatologist, but also trust sources that are vetted because there's a lot of misinformation out there. The one that I like is www.somethingdifferent, so that's all one word, .com. It's a great resource for everyone.
And I didn't get a chance to talk to you about triggers because when you have psoriasis, what are some of the things that actually can trigger it again?
Yeah, so common triggers are if you get sick, and it could be a viral illness, it could be strep throat, it could be if you got sick with a bacterial infection, but also if you're stressed. We know that stress, physiological stress, psychological stress could trigger it, as well as certain medications. And so I see this quite a bit. Someone started a new medication and their psoriasis flares. I'm always looking at their medication list to make sure it's not one of the culprits.
Yeah. And Margie, for yourself, obviously, you've got family. Talk to us about that whole component of having a support network because as you're making some of these adjustments and some of these things really do have the emotional and psychological impact, it is great to have a support group around you. Talk to me about that group.
Well, my group is primarily my family, and they're wonderful. They understand why my hands look the way they do, and they encourage me daily to find proper ways to handle my psoriasis, or they even remind me, put some lotion on. It's that group of people, but most importantly for me is my dermatologist, because that person is my biggest advocate and is always trying to find something better that I can use.
Yeah. Dr. Songwan, thank you so much for being with us. I guess you gave some great information there. And then also, Margie, thank you so much for sharing your, your story and your journey, and best wishes to you as you go on in the future.
Thank you.
Thank you. Thanks for having us.
All right, Dr. Song, I'll get you with one last word. Again, tell people for more information what they want to do.
Absolutely. So www.somethingdifferent.com.
All righty. Dr. Song and Margie, they're talking a little bit about plaque psoriasis, an up-close and personal look. Again, the website, psomethingdifferent.com. Stay with us. We do have more open coming up right after this.